Hello, everyone.
Hello.
Only 10% of regulated early care and education seats in Wisconsin serve infants. These are our most precious assets, and also those who can't tell us about their own experiences during the day. My question for all of you, young parents need infant care most. What are your goals for creating more infant and toddler care so families can stay in the workforce?
The beginning of the answer to this is paid family leave, which is something that I have championed and authored since I think 2011. So before a lot of people even knew what paid family leave was. It is essential for families to have that early bonding time with their baby. And it should not depend on the wealth of the family or the kind of job that you have, whether you get it or not. It's also, by the way, important for early childhood providers and educators to be able to have that time on as employees and workers themselves. Fran was touching on this, but there is a tension between expanding 4K programs in public schools because 4-year-olds subsidize infants, and it's virtually impossible to make the numbers work in an early childhood center for infants if you don't have 4-year-olds, just because of the ratios. I mean, this is not something where you can automate or efficiency your way out of this problem, and it just requires more money. We have a mental health crisis among children in this country. And one of the things we don't talk about very much is infant mental health. And it starts by having that attachment, that safety and security of a loving caregiver as an infant. And that is why the idea of increasing ratios is anathema. We cannot do it. We have to simply put the money in, and we have to make sure that there are staff that are specifically trained in infancy and birth to 2, which is different than just early childhood overall. That's why making it free or affordable to go to school and having loan repayment programs is essential to solving this crisis.
It all comes back to having money in communities to be able to provide these sort of services for infants. And it goes back also to the conversation about being able to hire teachers, being able to hire educators, which is a persistent challenge. Now, what I have proposed is making sure that continuing education programs are available, free and low cost technical college education for people to go back to be specifically trained to have the skills that are necessary to take care of infants, but also paid family leave goes a long way as well, because while it is important to have infant care, it is also important for that family time to be available, and many parents are at risk of losing their jobs if they even think about taking time off to be with their children, or because not losing their jobs could be losing a home or getting evicted because you are going to miss that paycheck simply because you wanted to take care of your child. Now, this unfortunate reality that we find ourselves in, it treats bringing a child into this world not as the blessing that it is. It treats it like a burden. And the United States of America is so far behind other developed nations in getting our act together and being able to create stable family situations. And it's so funny because there's another political party that always talks about family values. And lo and behold, they never passed a single family value piece of legislation. Anytime something's been introduced, it's never got a public hearing. They never hear it. You have a former governor who made things harder for children and providers in this state as well.
I mean, I think it's clear. The infants are the most expensive. I was talking to somebody over here who is closing their infant room simply because they of that expense and the caregivers that are required there. And we all know how important that is. And so, you know, everybody has said that starting this with paid family leave is critically important for families. But there's also ways that government has to be a partner in this. In my home community in Milwaukee, I worked with a network where United Way, which was backing off of being involved in early childhood education, can be part of that. Philanthropy is not going to take all of this over, but if government is doing its job, then philanthropy should be there and the corporate community should be there to be able to do this as well. You know, there are things around training that are absolutely important to do. I don't think any of us has mentioned the WECA rewards program that, you know, the largest chunk of funding you ever got was through COVID money. And then there was one budget that there included a little bit more, but since then there has been nothing. Like a sustainable intentional way that you can continue to do that. And then working with technical schools, then working to ensure that young people, even as quick as early as high school, are getting into apprenticeship programs. So this is one way for us to start to deal with this in a long-term and in an intentional way, rather than lurching from crisis to crisis to crisis. So like, this is, I think, how you ultimately deal with this over the long term.
Absolutely. Thank you for that question. And I think that paid family medical leave is absolutely one of the key points here. And this is important for me because when I became county executive, there were so many people who were struggling to find childcare. And one of the first things that we did is that we actually expanded family leave. And we expanded family leave not just to males, but we actually expanded it to where you didn't have to go through a probationary period anymore, right? Because there are many women who may be actually pregnant and can't find employment because they are pregnant. And so we actually institute a paid family leave to make sure that no matter when you're hired, you can get access to the care that you need. You can stay at home and do what you need. But we also need to make sure that there are providers that are available, which goes back to how we invest upstream. How is the state going to make sure that we have enough early childhood care providers is extremely important. And so we can't just keep talking about it. We have to put our money where our mouth is. And so at the end of the day, we have to continue to put our money where our mouth is, but it's about working with you all, having a better understanding of what the expense really is. And that's what I mean by understanding what the floor is by getting those dollars in the door so you can have everything that you need to sustain your businesses.
The care infrastructure, care economy, caring for folks who care for our most vulnerable. The disinvestment from this and not seeing it as a public good has led to this crisis. And so I think the solutions have to match, the solutions have to be comprehensive enough to make sure that we do not come back to these moments. So the investment must be in both workforce and I think also in enhancing partnerships that are private-public, but we've also disinvested in our tech colleges, and the direct provider payments to infant programs is something that I would support. To have flexible funding, making sure that if there are partnerships with local universities, that we are investing still in loan forgiveness programs for folks going into early education, that we see and help get state funding to build partnerships that are within research and in the education systems. I think that this really comes down to prioritizing funding and making that funding easier, accessible, and more equitable to access. And that requires navigation programs as well. Infant care is one where just because it is the most expensive doesn't mean that we shouldn't be investing even more heavily into it. And so expanding the direct provider payments, investing in workforce, and uplifting partnerships with tech colleges as well is where I would put additional investment.